So a little bit about the background of the WHO and why this is important. So as you know, the WHO deals with 53 member states, nearly 1 billion people. So it's a big chunk of the population of the world. And there are massive challenges around health, and there are different health and digital situations in each individual country, and the trends within countries are different as well. The COVID-19 pandemic, it's a fond memory now, I think we might say, but it still sits there and prescient for us because people are recovering, countries are recovering still from the pandemic, and there are significant impacts around workforce on that. And then, as we all know, there's a digital health fever floating around the world, people getting very excited. You're all here to talk about digital, to talk about the role of the electric chips, etc., in health, but digital technology has an impact on the workforce, and it's important that we take that into account. So the context that I talk about is the framework for action, and I'm terrible at this, so I'm going to take a mic if that's okay. I tend to wander around. So the context that we're working in really is around the framework for action. And the framework for action is built around 5 main pillars, and it talks about investing in the workforce, building workforce supply, retaining and recruiting workforce, optimizing performance, and planning. And in all of this, the role of digital technologies is important, and I've highlighted some of the ones where it's key. And particularly in planning and optimization of the workforce, it is significant. In investments, we need to make investment cases for delivering services that take into account the role of digitalization and technology and how that impacts on the workforce. And then as we're building supply and retaining and recruiting people, we need to take into account the changing world that people are working in, increased digitalization, in use of technologies, and the impact that that has on training, education, skills mix, mobilization, placement of workforce, and on and on. It is a massive agenda, and any workforce planners in the room will tell you it's not just about planning the workforce, it's about making sure you have the right workforce with the right skills at the right places with the correct tools. So the challenges, as I say, we collectively face, the lessons of COVID, but we've got an aging population. So we have 1 billion people, and that population is aging. And we're going to go from a dependency ratio, which is around 3.1 in some countries. These figures are for Europe at the moment. And that looks like, particularly in Germany, that's going to go to 3.2 by 2100. Okay, so what does that mean? That means that 3 people will be working whilst 2 people are either in retirement or not working. If you consider the trend that people have got to working fewer hours, that makes it look even starker. And so we have to utilize technology in the way we deliver care and in the way we think about looking at care. And the other thing we've got to bear in mind is that workforce is aging as well. And even though they are going to retirement ages are creeping up, health is a really it's a physical job. So you can't expect your elderly, older workers to do the same things they were doing when they were younger. So there are increases in demand in services and a smaller pool of workers, and we need to build trust and transform. But let's talk about it as it was, reshape the way we do things, get the patient involved, and utilize digital enabled services. Our role in the Digital Health Action Plan is to promote digital health systems that improve health at scale. Going back to the scope of this meeting, leveraging and scaling up for digital transformation in better health and aligning the technologies with investments in the health system. That's the mission plan. And we need to think about, and I purposely talk about governance here, because governance of the way we deliver the workforce, the training we give them, it's important. And that means looking at the way we roll out digital technology. Why is it important? Because if you don't invest in governance, you kill people. That's stark. Okay. This information here, we collated all 53 member states, and we've actually done it for the world. We'll be producing a report, and we look at government effectiveness, corruption indices, government effective indices, basically proxies for governance, and we look against health outcomes, universal health coverage. And what we see at the bottom, at the end, just looking at universal health coverage against government effectiveness, at the bottom, that's where people invest the least in governance of the health system and governance of the workforce supply chain and governance of how you enable that workforce. And these countries at the top here invest more. It's a straight line trend right the way through. Doesn't matter what type of governance indicator you take or what type of health indicator you take, actually the shape of the graph never changes. It is stark. So if you don't invest in making sure that you govern your workforce supply and you equip them with the right tools, governments are going to kill people. The optimization of workforces, therefore, means that we should be looking at technologies and that respond to patients and worker needs. We think about, I mean, these are the 8 items that are within the digital strategy. I won't read through them. You'll get these slides. But effectively, if you're going to optimize health worker performance, you need to make sure that you're dealing with appropriately with the technologies that are going to come forward. And that means building technology into your workforce planning, into your workforce supply, into your workforce enablement, into day-to-day training.